Humboldt, yes. So in 1974, I started my college career in my first environmental health sciences class, and there was a poem that was a very short poem that was presented at that class, and it stuck with me. I remember to this day, I use it all the time. And it's very apropos for what Tom did this morning. I just want to read it. And it's by Francis Thompson, and it goes, "All things by immortal power, near or far, hiddenly, to each other linked are, that thou canst not stir a flower without troubling a star." So the notion that anything you touch here at this micro level can affect the whole universe is something that stuck me with forever, and I think that's part of the interconnectedness that we've talked about here today. So thank you for giving me that minute, and then I'd like to now turn to the first panel, and we have John Samet moderating the panel on the foundation. So John, I'll turn it over to you.
Okay, thanks, and our panel was foundations. We had a lively discussion, touched some issues, and left many untouched, not surprisingly. So I guess we'll start to the far right, Ogonnaya, if you're ready. And we'll hear from Ogonnaya Dotson-Newman from the JPB Foundation. Thanks.
Okay. You can hear me. Oh. I'm like, I solemnly swear to tell. So my name is Ogonnaya Dotson-Newman, and I'm really happy to be here. I thank you all for the invitation. I'm a program officer with the JPB Foundation, and I just thought I would start my remarks with a short intro to the JPB Foundation because a lot of folks don't know who we are. JPB just stands for the folks' names who provided us with our endowment, Jeffrey and Barbara Pickauer. The JPB Foundation has been around for a little over 6 years. Our mission is to support innovative initiatives which lift people out of poverty, provide innovative medical research, and support healthy and resilient communities, which means we fund in medical research, poverty, and environment. Our environment program, which I'm a part of, has 3 separate sub-areas, and those sub-areas are energy, green infrastructure, and environmental health. I think we're really excited to be here because we haven't been around for that long. We see ourselves as a national funder that can really support, I guess, like filling some of the gaps and following the lead of our more seasoned funder partners in really making the connections and really doing the work that needs to happen to support all kind of like components within the ecosystem of environmental health. And so I definitely really was excited to hear, and a lot of the comments of our colleagues really resonated with me at this specific meeting, especially because there is a real opportunity to, I think, like leverage and really use the, I think, meeting power of the national academies to really be able to bring together a number of different folks who have different vantage points that can really see the entire ecosystem of environmental health and what that really means for us to really solve a lot of the challenges that we see today. Some of the ways that JPB does that and that we also really think will be exciting to see how that works with the national academies and the number of different sectors that are in the room are through providing support for environmental health infrastructure. And what I mean when we say environmental health infrastructure is how are you supporting community-based organizations that need support around capacity building to be able to use cutting-edge research that they would hopefully get around environmental health initiative from the national academies. How can they then use that to really be able to create change and leverage their own political will in those communities to really make recommendations and fight for better environmental health conditions? That means how can we support researchers that may be early career researchers through fellowships and mentorship to really find ways so that they can actually be supported to do work that involves communities who are identifying problems and not just doing research for the sake of research. What that also means is that we're thinking about the intersections between innovative and things that are happening in our lives that we live, but aren't always reflected in the research that we're doing in academia. So how can we look at health and housing challenges that we're having and figure out really clear ways to be able to support researchers to do healthy housing research that can then be translated to the communities, that can then be put into and come forward with people that are actually making key decisions. And I think finally, we see all of you all as our partners, and we look forward to participating in future meetings like this to really be able to think about the ways that foundation can add to the ecosystem, and also the ways that we can leverage not just, I think, our pocketbooks, but also we can leverage our own convening power, some of the knowledge that we're able to glean because we are sitting sometimes from a different vantage point, and be a thought partner to figure out how we can come to really some collective solutions that are incorporative of as many different aspects of the national academies and of the real world as possible.
Okay, thank you. So why don't we next move to Shelley Hearne from the Forsythia Foundation.
Great, thanks, John. You've been a very good point guard for this whole. I say, he's a power forward.
It's World Cup time. He should be like a stopper.
No, I do this because the way I met John was on a basketball court, and we have a little bit of a height differential. But I came to learn to enormously respect John after he taught me how to play basketball properly from them. So I wear a few different hats in the philanthropic side. One is heading up the Forsythia Foundation, which is focused on eliminating, reducing toxics in the world we live in, whether it's consumer products or water. And it focuses predominantly on supporting advocacy organizations in the space of federal, state, and increasingly city policy advocacy work, along with trying to boost the use of green chemistry and a number of alliances with business entities, ranging everything from GC3, a group that's networking business interests to share data on green chemistry, to actually starting a venture capital fund on trying to invest in early innovations of alternative substances, and really recognizing a range of, from policy advocacy to business collaboration. We got to do it differently out there. But another hat I wear is an initiative that's just been launched by the de Beaumont Foundation and Kaiser Permanente, which has an element of tracking the 9 policies that a city should have on its books in order to be the healthiest place possible. And it looks at the key, I can say this word in here, social determinants of health, and has picked a policy based on science first. And it's drawn from work that the Academy has done, IOM, or that CDC and its High Five initiative, where it looked at what the science said, or RWJ, which also drew from the scientific base. What were the policies that had the greatest health impact? Measures the largest cities, but then provides grant dollars to city entities, to NGOs like American Heart, to Kansas City Chamber of Commerce, a variety of entities on how they can help move and advance those policies. So it's a range of philanthropic work. And to piggyback, vegetarian back off of you again, that was her phrase. I love it. I haven't quite gotten it right, but we've used a lot of, in our various work, Academy reports, but have not really looked at the intersection of partnering or what we could be doing to help support and facilitate the Academy, because a lot of times those reports were seen as, for the most part, sitting on the shelf, or recommendations that weren't always things that we could put into action. And I think what is exciting about the conversation that's here is not only connecting the dots amongst the many different assets that the academies have, sciences and engineering and medicine, but the potential to really harness, and this is something our group spent some time talking about, that from the philanthropic side, we're in Tom, I don't know how you label your concentric circles. I know you thought it was a target on the but as you got in towards the human health side, the space that the philanthropic conversation focused on was the implementation circle, the action side. And for the most part, that's where a lot of our investments are, is how do you take that evidence? Because everything I heard in our group was we're all starting from a place of science first. What does the evidence say? These are, we are making investments that we know the facts line up. But we're also, our measure of success is how do you get those facts into action? How do you make the policy actually be implemented? How do you get the practices that we know would be best, that the community wants and the science supports, how do we get those over the finish line? And to the degree that the way I heard that conversation this morning, and where kind of all these light bulbs are going off and all the excitement, and I don't usually use excitement in the academy in the same word. Is that bad to say? And I don't usually hear poetry in the academy at the same time. And I'm having a really good time here today because it's a little bit of mixing it up and a little thinking differently and going outside the box. And the challenge here on how could we take the extraordinarily valuable, reputable, treasured assets of the academy and help increasingly fill the gap we have of being the honest broker in helping implement smart, pragmatic, health-first, science-first ideas over the finish line. And that's in a more rapid response way. Or in consultations, there are many things that we're working on that if we had the academy helping advise and counsel on what's the best policy that a city should have for environmental health measures, we would automatically, if the academy said it's this, then bingo, that's in. And that's a kind of partnership alliance that had not been imagined before. But if I think the door is, what I'm hearing, it's being open. And so that was a lot of, I think the excitement here was how can we get our intersection. David, I think you had said the idea of, we got to help boost the audacious ideas. You had a great litany, and if I put my reading glasses on, how do we help fuel those ambitious ideas that impact vulnerable populations, that are solutions that are intersectional and that it taps into the emerging science? That's what the academy can help in combination with philanthropic ideas that connect to people, that connect to communities. That's poetry.
And that was the end? Next. Okay. And next we'll move on to Phil Johnson from Heinz Endowments. Phil.
Thanks, John. Heinz Endowments is a family foundation in Pittsburgh, Western Pennsylvania. That's where I work. I do environment and health work there. I've been there about 10 years. And before that, I was in environment and health academic and regulatory work. And then way back, I actually did advocacy. So I've kind of lived in different worlds throughout my career so far. And I got asked a very fair question today. And I get asked the question a lot as a grant maker. And it was like, how do you evaluate your work? Like, who holds you accountable? And so my three-part answer was, well, at the end of every grant, the grantee fills out an evaluative form. There's questions and answers, and it's their opportunity to tell us how they thought the work went. What were their measures of success, and how did they perform, and why? The second way I'm evaluated for my work is my leadership and my board, because it's my leadership's in charge of managing a staff, and the board is in charge of paying attention to the recommendations of grant makers as to how to move the money out the door per IRS requirements. And then the third way I'm evaluated is through a 360 from the Center of Effective Philanthropy. So any organization or individual who receives money that I recommended that we spend, they have a blind 360 process to talk about me and what I do. And so, you know, those are how I'm held accountable for my work to advance environmental health solutions in Western Pennsylvania. And the second piece of that is interesting because, you know, how does the board and how does how do my bosses measure me? And that comes down to what are the strategic objectives that I have and do I accomplish them? So when we think about today and where the academies is going and each of our respective hats that we wear when we're not here and when we're at our job, it's, you know, that's kind of the question, right? Like if you all got asked that question today, how would you answer it? And how do you measure your success and what are your strategic objectives? So I kind of got put on the hot seat, and I don't know if I had the best answer, but I had an answer, and I think that knowing what our objectives are, or having the opportunity to think of new creative ways to have different objectives about how to advance environmental health is really what's happening here. It's pretty exciting to see it happening in real time. So I think it's John's charge really to talk about how our panel discussion went, but I just wanted to give you that limited perspective from a grant maker.
Are you asking him to evaluate us?
Yeah, John's going to evaluate us, Shelley says.
Well, great. Thanks. I think we're going to move on to a panel discussion. I'll take a few minutes just to highlight some of the other elements of the discussion and a few of the words that came up. I think one thing that was clear is that this initiative is about doing things differently, and that needs, whatever it is that is different, it's not reliance on just the old models of consensus studies and other things, but new approaches. And we spent a fair amount of time on what some of those new things might be. There was a great deal of discussion about implementation, which has not been something that the academies has been involved in, but it could be helpful, for example, in convening groups to discuss problems in implementation or issues in implementation. There was a lot of discussion about, I'll use some of the words, thought partnerships and new ways to collaborate, new ways to get inputs, community interactions. And we talked about the idea that the problems that the initiative might address might not be only those sort of big, broad international things, the things that are causing huge amounts of death and disability, but problems that arise at the local level that are perhaps shared across many communities, things like West Oakland with hot spots of pollution. As one example, we talked a little bit about priority setting and what are the metrics for doing that. We talked about the communications challenges of reaching to many different groups. We talked about what are the pathways for this initiative to reach to communities and to partner with those who do reach to communities as part of what they do. I think one interesting comment that came up towards the end was the fact that, yes, there have been many academy reports and roundtables on the environment, probably with thousands of recommendations, some of which have probably proved quite useful and some of which are neglected. And there might be something to be learned by a look back and seeing where things have proved effective. I do like, just quoting Shelley again, with what she said, this idea of facts into action or knowledge into action. I do think that that's sort of underlying what we are talking about. And I think the other, on the communications challenge, we talked about the sort of the broad general need of helping people understand from early on, maybe this goes back in early STEM education, what is pollution and how does it affect us, and to have a public that's primed to understand that. So I think we probably have about 10 minutes for general comments, discussions, points to raise, and questions for the panel. So please come to the mics and ask away. And remember to identify yourself.
Hi, I'm Christy Poland-Vodenik at NRDC, the Natural Resources Defense Council. And one of the things that I thought was really beautiful about the discussion we just had was the focus on creativity, right, and the funding landscape, being interested in that. And one of the things that I struggle with is, a love of creativity and wanting to do new things. But I also wonder about the old way of doing things. So thinking about self-assessment, have the foundations, or you can speak for your own foundations or others if you've heard of this, done an analysis to identify what has worked, what has produced the largest ROI. And then sometimes it isn't reinventing the wheel. There's a story that, the Americans wanted a pen, it's something that wrote upside down, wrote in zero gravity, wrote underwater, wrote on fire. And then the Russians, at the point, you could say this, used a pencil, right? So we spent $1 billion on something to develop this pen that could do anything, but a pencil worked. And so are there examples of a pencil that we could be thinking about as we move forward with this initiative? So, valuing creativity, but that at the same time, ensuring that we can identify things that have worked. So we want to affect change. How do we do that? And what have you seen in your experiences?
I'm going to try to answer that two different ways. One is what Phil was talking about in the evaluation it goes through. The fact that you're willing to open yourself up to that 360 from your grantees, that shouldn't be creative, though unfortunately that is. I think that's an exception in the philanthropic world, and I want to applaud, even if you don't want to be doing that, applaud the fact that you are, and that's a kind of accountability that would be really healthy to have in philanthropy. There are a lot of lessons that get learned in the philanthropic arena. Often they get hidden. They're not always shared as best practices. There are a number of efforts, though, to bring more light of day. Kathy Sessions is here and represents the Health and Environment Funders Network, which is a consortium of groups getting together, sharing ideas, sharing best practices, and trying to get that information out more and more, not just to inside, but outside, so it's not also such a black box of what goes on in the decision making. There's also the philanthropic field will do evaluations on the outside of various initiatives. And there's some really interesting reports that often don't get seen the light of day. It almost sounds like I was kind of chastising the Academy of there are these reports that sit on the shelf and don't get seen. Oh dear, the philanthropic world does that too. It's not an unusual phenomenon. But things like what makes an effective coalition. That would be really important, powerful information. That was produced by a national foundation, but it's an insider document. But it's huge lessons that inform them on how they go forward, but it could be very useful for a broader community. Not that that's something the Academy would curate, but I think there are ways that we should be thinking about. There's a lot of information out there, whether it's EPA that might be having its information disappear, or really good data that the Academy has put together that doesn't always come along, or other partner groups that needs greater visibility. I do think we have to get greater transparency on these and evaluation and lessons learned.
Yeah, so I think another example is, philanthropy. This is going to be like philanthropy specific, but I think it's like pervasive. So philanthropy, especially environmental philanthropy, has like a diversity problem. And so there's, diversity, equity, and inclusion challenge. Can we edit that and reframe it? And as a result of that, there was a report that was done called Green 2.0. And what is interesting to me about Green 2.0 is that there was a very hearty report done there that also had to have environmental philanthropy and some mainstream environmental organizations that actually reported and opened their data about that. And then that translated into a number of different initiatives that individual organizations are doing, but also that has resulted in a fellowship program that we support and some other foundations support. And so I think that that's probably an interesting example too that the Academy could use as an idea around there is a specific kind of component of like environmental health kind of stuff that was identified. There was some research that was done on it, and the researcher doesn't have to implement all of that work. Like, it kind of operated in an ecosystem, and then people are using it as an opportunity to have discussions, to continue to write papers. There are a number of different diversity initiatives that are having. I would by default say that, like, I could be, I mean, there's no like actual evidence of cause and effect. I could also be like a product of, like, you know, the overall kind of like field of philanthropy, recognizing that there need to be different types of people with different ideas, and then it goes like downstream. So I think that's an interesting one that could easily be overlooked, but it actually has a number of different components and also represents a number of different parts of the sector that are trying to use the evidence that we all had to co-create and that is valid to then like go into solutions.
I just wanted to briefly reinforce your answer as well. You'd asked, you know, what's that pencil moment where something simple actually might be there all along. And I've had a couple of those moments with our work in Pittsburgh. We invest heavily in science-based decision-making, and we make grants often to academic universities. We also make a lot of grants to communities and NGOs. And for me, the pencil moment is when community leaders embrace something, call the shots, and kind of lead where the discussion and where the initiation goes. And environmental health in Pittsburgh disproportionately impacts our African American communities. And when we support community leaders from our hardest hit communities following their priorities and their agenda, that's when things start to happen. And when they have control of the resources and the agenda, it really can move the ball forward. And then the other pencil moment is, we're blessed in Pittsburgh. We have engineering institutions, and there's many engineers who want to do pro-social work. And we have engineers and robotics engineers who actually do environmental health work in Pittsburgh, and they're geniuses with data visualization, and they communicate the environmental health challenges in brilliant ways that compel politicians and businesses and leaders to actually make a change. And so the pencil moment there is how can you communicate visually things that don't need to be that complex?
So we've got the red light, so time for one very brief comment.
Quick question. Dr. Samet, it's a question for you, and I feel lucky that you're here to ask the question of. You were the chairman of the World Health Organization working group that classified wireless radiation as a possible carcinogen.
Remember, we want to stay on topic with our foundation discussion.
In 2011. And cancer epidemiologist Dr. Hardell and Dr. Miller believe it should be reclassified given the Ramazini.
Let me make a suggestion. This is so much off topic. I'd be happy to talk to you afterwards.
Okay.
So why don't we do that?
Just want to know if it was really able to be reclassified.
So let's not wander off topic when we're running out of time here. But be happy to talk to you privately about this. So let's see. I think thanks to the panel, and I think we are done with our job. Thanks, guys.